Have you ever wondered how diabetes medications actually work in your body? Diabetes, a prevalent health condition, affects blood sugar levels and in turn various aspects of our health. One of the key strategies in managing this condition is the use of injectable medications designed to control these sugar levels. Among a plethora of options, two names stand out: Mounjaro and Ozempic. These medications belong to a class of drugs known as GLP-1 receptor agonists, which cleverly mimic the effects of certain hormones that regulate blood sugar. Beyond controlling sugar levels, they also promote weight loss by slowing down the digestion process. So while you're managing your diabetes, you're also managing your weight. A double win. But how do Mounjaro and Ozempic differ from each other? And how do they fulfill their roles in our bodies? Well, stay tuned as we dive deeper into the differences between these two medications. Let's start by understanding Mounjaro, a unique player in the field of diabetes medications. Now, what sets Mounjaro apart is its ability to activate not one but two gut hormones. This dual action makes it a powerhouse in keeping blood sugar levels under control, a key concern for those dealing with type 2 diabetes. Mounjaro's two-pronged approach is akin to having a dynamic duo on your side. It mimics the effects of natural hormones that keep your blood sugar in check, ensuring that it doesn't spike after meals. But that's not all it does. Mounjaro also helps slow down the rate at which food leaves your stomach. This means you feel full for longer, which can aid in weight loss. In fact, a whopping 80% of users have reported losing at least 5% of their body weight. But the benefits of Mounjaro don't stop at blood sugar control and weight loss. This medication also aids in reducing blood pressure, a factor that often comes into play with diabetes and can lead to heart complications. By helping to keep your blood pressure in the safe zone, Mounjaro plays a vital role in maintaining overall health. Now, you might be wondering about the practicalities of using Mounjaro. It's an injectable medication, which might sound daunting, but it's only required once a week. That's one small prick for a week's worth of benefits. On the flip side, Mounjaro does come with a higher price tag compared to some other diabetes medications. However, the potential benefits it offers may outweigh the cost for many, making it a valuable addition to their diabetes management plan. Remember, the effectiveness of Mounjaro varies with each individual. Hence, consulting your healthcare provider is crucial. They can guide you on whether Mounjaro is the right choice for you, taking into account your personal health profile and treatment goals. So that's Mounjaro, a unique and potentially beneficial player in the world of diabetes medication. Moving on, let's break down the workings of Ozempic. This medication, like Mounjaro, is an injectable meant to help control blood sugar levels in those living with type 2 diabetes. It falls into the category of GLP-1 receptor agonists, a class of drugs designed to mimic the effects of certain hormones that regulate blood sugar. Now, Ozempic does more than just help keep sugar levels in check. It also aids in weight loss. How, you ask? Well, it increases the time it takes for food to leave your stomach, helping you feel fuller for longer, and thus eat less. This dual action of blood sugar control and weight loss makes Ozempic a valuable tool in managing type 2 diabetes. But that's not all. Ozempic has another feather in its cap. It is FDA-approved for people with type 2 diabetes and heart disease to reduce the risk of cardiovascular events. This means it can help not just manage your diabetes, but also protect your heart, making it a vital player in your overall health strategy. Now let's talk about the practical aspects of using Ozempic. It's a once-a-week injection, which means you don't have to worry about daily dosing. However, it's important to note that it does come at a cost. While generally less expensive than Mounjaro, the cost of Ozempic can still be a consideration for some. Like Mounjaro, the impact of Ozempic is subjective, and it's essential to discuss its use with your healthcare provider. Now that we understand both medications, let's compare them head-to-head. Mounjaro and Ozempic, both injectable medications, are used to control blood sugar levels in people with type 2 diabetes. But how do they stack up against each other in terms of effectiveness? Well, Mounjaro has proven to be quite effective for blood sugar control and weight loss, with a whopping 80% of users losing at least 5% of their body weight. It activates two gut hormones, extending the time it takes for food to leave the stomach, thus making you feel fuller for longer. On the other hand, Ozempic, a GLP-1 agonist, has a unique advantage. It's FDA-approved for people with type 2 diabetes and heart disease to reduce the risk of cardiovascular events. Not to be outdone, Mounjaro also lowers blood pressure, potentially reducing the risk of heart complications. Now let's talk about cost. Mounjaro generally comes with a heftier price tag than Ozempic. However, the value of a medication shouldn't be solely based on its cost, but rather its effectiveness and how it aligns with your personal health goals. While we've compared these two medications, remember that the best choice depends on your individual needs and treatment goals. It's crucial to have a conversation with your healthcare provider about these factors when deciding between Mounjaro and Ozempic. Choosing a diabetes medication isn't a decision to be made lightly. In the world of diabetes care, medications like Mounjaro and Ozempic can offer promising outcomes. Yet it's important to remember that each patient's journey is unique, and what works for one might not work for another. This is why consulting with healthcare providers is crucial. Healthcare providers are trained to navigate the complex landscape of diabetes management. They understand the nuances of different medications, how they work, and for whom they are best suited. When choosing a medication, it's not just about controlling blood sugar levels. It's about considering your overall health, your lifestyle, and your long-term treatment goals. Switching between medications like Mounjaro and Ozempic should never be done without professional guidance. While both are designed to help manage diabetes, they work differently, and their dosages vary. A sudden switch could disrupt your blood sugar control and potentially lead to unwanted side effects. It's like setting sail on a new course without a compass. You might end up lost at sea. Communication with your healthcare provider is key. Don't hesitate to share your treatment goals, your concerns, or any changes you notice in your body. These conversations can help your provider tailor your treatment plan, ensuring it aligns with your needs and lifestyle. Remember, managing diabetes is a team sport. You, your loved ones, and your healthcare providers are all players on the same team, working towards a common goal, your health and well-being. So whether you're considering Mounjaro, Ozempic, or any other diabetes medication, always consult with your healthcare provider. They can guide you through the maze of diabetes management, helping you make informed decisions that support your well-being. Remember, your health and well-being are paramount, and your healthcare provider is your best ally in managing your diabetes.